Dear friends, today we are talking about silent reflex, also known as laryngopharyngeal reflex (LPR), what it feels like, why it happens, and what actually helps. Alright, let's get into it. What is silent reflux? Silent reflux happens when stomach acid travels up past the esophagus and irritates the throat, voice box, and airways. This is different from regular acid reflux or GERD. In silent reflex, you usually don't feel heartburn. That's why it's called silent. In silent reflux, instead of chest pain, the acid affects sensitive tissues higher up. These are the places that aren't designed to handle even small amounts of acid. Silent reflex symptoms. Silent reflex symptoms can be sneaky and confusing. Some of the most common ones include constant throat clearing, a feeling like something is stuck in your throat, chronic cough, especially after eating or at night, hoarseness or a weak voice, sore throat that never seems to go away, postnasal drip or thick mucus, trouble swallowing, a bitter or metallic taste in your mouth. A lot of people get misdiagnosed with allergies, asthma, or sinus problems when reflux is actually the root cause. Why silent reflux happens? So, why does this happen? It usually happens because the upper or lower esophageal sphincter is weak or not working well. These valves are supposed to keep stomach contents in the stomach. Common triggers include eating large meals, eating too close to bedtime, high fat or fried foods, coffee, soda, chocolate, or alcohol, stress, obesity, or increased abdominal pressure. Unlike GRD, even small amounts of acid can cause big symptoms in LPR because the throat is extremely sensitive. How silent reflex is diagnosed? To diagnose silent reflex, your healthcare provider will ask about your symptoms, review your medical history, and do a physical exam. Besides, your doctor may also recommend laryngoscopy, which uses a small flexible camera to look at your throat, or pH monitoring to measure acid levels. Treatment for silent reflux. Here's the good news, silent reflux is very manageable. Treatment usually focuses on lifestyle changes first, sometimes combined with medication. Lifestyle changes that help a lot are as follows. Don't eat 2 to 3 hours before bed. Elevate the head of your bed. Eat smaller meals. Avoid trigger foods like caffeine, spicy foods, tomato based foods, and mint. Stay upright after eating. Manage stress. Medications. The most commonly used medications for managing silent reflux include antacids, proton pump inhibitors, PPIs, and A2 blockers. Silent reflux often takes weeks to months' time to improve. Besides, staying consistent and patience is key to long term relief. When to see a doctor? If you have ongoing symptoms for weeks or months, trouble swallowing, voice changes that won't improve, unexplained weight loss, please see a healthcare professional. Thus, we see that silent reflex is common, misunderstood, and very real. But once you know what you are dealing with, it becomes a lot less scary. If this video helped you, hit the like button, subscribe for more health breakdowns, and drop a comment.